Good Monday morning, everyone. Hope everyone had a great weekend. It is November 15th. Welcome into the Morning Medical Update. We are live inside the Dolph Simons Family Broadcast Studio. Coming up today, so far this month, the state of Kansas reported more than 2,500 COVID cases in children, 10 pediatric hospitalizations. Today, we will talk with one boy who is more than ready to get his first dose so he can help keep himself and others safe. Plus, we'll break down how COVID is affecting our metro area. So get your questions sent in to us via Facebook, YouTube, and the Medical News Network. You can find those links there right on your screen. But first, Medical Director of Infection Prevention and Control, Dr. Dana Hawkinson, joins us with numbers. How did we do coming out of the weekend? Good morning, by the way.
Yeah, the Chiefs won, KU won.
So you're good.
But I think more importantly is our numbers have really stayed the same. They haven't increased too much. We've been, again, in that high teens, low 20s for quite some time. We have 18 active infections right now, 5 in the ICU, and 4 of those on the ventilator, though. We do have 1 fully vaccinated patient in those 18 active infections, and still 19 additional patients that meet that recovered criteria. And Hayes, as of Friday, had 4 active infections and 6 in that recovery period. So hopefully, again, they have a smaller hospital, so cases to them really can mount and matter. They are seeing their active infections go down for those hospitalized patients, so that's good.
All right, thanks for the update. Before we get too far in, do we have any reporter questions on the line today? Okay, so again, we're going to get to our YouTube and Facebook community questions here in just a few moments again. So get those sent in. Kids ages 5 to 11 are pumped to get their COVID vaccines. Who knew they would ever be this excited to get a shot? Could it be that they know that this will be the ticket to get life back to somewhat normal? So plenty of eager kiddos are ready to take their place in line. Alexis Del Cid introduces us to one little boy ready to roll up his sleeve and take his shot.
The little guy you're about to meet can't wait to get his vaccine. He is full of joy and full of life, but like so many children in the time of COVID, he's had his share of stress and loss.
This is my dancing.
Everything 8-year-old Russell Dorn says,
exercise like side steps.
And does,
Let me show how fast I can do toe taps.
is peppered with movement and proclamations.
I can jump pretty high.
And this precocious 8-year-old has big plans for his life.
I want to be a YouTuber. I want to run a gas station that also has electric charging. I want to be a nanny, and I want to be a game tester for some sort of company.
He even came to meet us with a pre-prepared script.
You're looking at my intro script, and we're talking about the vaccines today.
But when it comes to talking about vaccines and the past 10 months, that's when this happy little boy gets a little quieter.
And the virus has been a very big scare to me. For most of the time it's been here.
Like so many children across the world, Russell has lost an adult in his family to COVID-19.
He was having anxiety symptoms.
His mom, Dr. Carla Carnes, says after his grandpa passed from COVID in April of 2020, Russell had trouble sleeping.
He was waking up with nightmares and just really having a lot of trouble.
And when she would leave the house for work at the University of Kansas Hospital, she says Russell would sometimes get panicked.
When my mom got vaccinated, I was so happy. She got vaccinated in December of 2020.
You could see the difference in him almost immediately because he felt much more secure that I would be safe.
Because I didn't need to worry about my mom, which is actually the person that I love the most. There we go.
That's when she says her boy started asking when it would be his turn.
He's been asking for months. He said, "Mommy, can you find me a clinical trial? Mommy, when can I get my vaccine?"
He knows to ask about clinical trials?
Yep.
How?
Well, because his other grandfather ran clinical trials for his job.
This and that.
He never did qualify for a clinical trial, but now Russell is on the brink of getting that vaccination. And he tells us he can't wait.
I kind of feel very excited.
He's so excited to play with his friends face to face again and to continue his Braille lessons in person.
Learning Braille is pretty cool.
But after all this time with Mom and learning from home, there's one thing he's not looking forward to very much: And that's in-person school 5 days a week.
I give it an average rating so far, but it's not something that would be a preferred activity at all.
As you can see, he's very honest. He also says that once he's vaccinated, he does look forward to seeing his pals again every day at school. I'm Alexis Del Cid.
Great story, Alexis. Okay, Russell, here he is in our studio this morning. So glad to have him along with his mom, Carla. Hey, buddy, how you doing? Also over here at our desk, we got Dr. Michael Lewis. He's one of our pediatricians here at the health system, and also glad to welcome in Dr. Alan Greiner, Unified Government Chief Medical Officer. Welcome to you both. You both are adorable, but not quite as adorable as Russell. So we're just going to go right back on over there and talk to him. Russell, thank you for sharing your story with us. Thumbs up. Are you excited about getting your shot today?
Yeah, I give a thumbs up and a half.
Thumbs up and a half. Man, all right. You are stoked. I love it. Okay, so Carla, are you super excited?
I am.
This is a big moment for your family.
It is. We're thrilled.
Okay, should we just get right to it?
Yeah.
Wow, you really are this excited. I love this. All right, so our pediatric nurses are here. We've said this before. Dr. Lewis, kind of talk us through it as well.
I have gotten scared before.
Okay, you're not going to be scared though this time, okay? Dr. Lewis is right here, and he's going to, so tell us about the dose and just why we have pediatric nurses doing this.
Yeah, so the dose is essentially a third of the dose of what we would see in the dose that 12 years and older would be getting. As a lot of times, people have come to us and asked us, like, I feel like this has come out quickly, but this has actually really not come out quickly. We were hoping that maybe we'd been able to see it even sooner, like maybe into the late summer or early fall. There was some pause of getting even more patients into the clinical trial and really making sure that everything looked great. But kids like Russell have done really, really well with the vaccine.
Russell, you're going to listen to your music, right?
Hey, pal, you're going to do so well.
Hey, Russell. Hey, Russell.
Russell, look at Dr. Lewis.
Scared.
It's okay,
I'm
Russell.
so scared.
Russell. Remember you said you would listen to your music? And what are you going to tell the other kids about being scared? What do you do to help not be scared?
Try to find something that's not distracting.
That's distracting?
Yeah.
Okay, can you listen to
You
your music?
should.
Hey, Russell.
Russell,
Something that really pushes your brain away
away from the needle?
from the
Okay.
distraction.
Okay. And what's
It
that?
distracts you.
Okay, Russell, Dr. Lewis wants to help
For
you.
me, it's
Hey, buddy.
music.
Hey, big guy.
Russell, it's okay.
I'm so scared, okay? I'm literally.
Let's worry about this. Let's think about this.
Russell, you picked it. You picked your favorite song.
Hurry.
Hey, Russell.
Sorry.
Hey, no one's doing anything. Do you want to wait just a few moments? Let's just wait a few minutes, okay? We got lots to get to today, okay?
Okay.
Do you want to, why don't you step back? Remember Alexis, who you spoke to?
Yeah.
Alexis, the nice lady, she's coming into the studio and she's going to take you out in the hall and you guys can just kind of hang out a little bit, relax, and then we'll think about it and do it towards the end of the show. Does that sound good?
Yeah.
Okay.
Let's go.
Cool.
Over here.
All right, bye, pal. We'll see you in a little bit, okay? That's how I would expect my kids to act. I was surprised when my kids were okay to get theirs. But it sounds like a good idea. Parents have been talking about this. But when you get to it, it's a shot's a shot, right? Dr. Greiner, what are your thoughts about kids getting vaccinated and those struggles?
It's a little more complicated, right, than what we've had with adults. We're running a mass vaccination site in Wyandotte County, Kansas City, Kansas, and we've had 4 days now, and most of those have gone fine, but we really need experienced pediatric people there. We need experienced pediatric nurses. We need a team that understands that kids are going to squirm. Kids do get fearful, and they need certain things in place to make that easier. So we can't do every shot at a mass vaccination site for sure. We can't do drive-throughs. It's just not going to work because you don't want to stick a kid 2-3 times because they're jumping around, and that. As Dr. Lewis knows, that can happen.
Yeah. Well, and that's why we said we have pediatric nurses. Not all shots are created equal. And I remember my son last couple Fridays ago got his and got a little squeamish, but those nurses are able to come in and handle him way better than mom would have even. So there's a reason why they do what they do.
My 11-year-old son was in the exact same situation as Russell. And so, the same nurses actually who are here today were the ones who gave my son his vaccine as well. And they know that when you walk in, even every time it's the kids talk about, oh, I'm excited to be here, I'm excited to be here. But there's definitely going to be some kids who are anxious. And that's expected. And it's something that I know our nursing staff and our clinics and here at the health system and really everywhere, they understand that, and they know that if it's not right then, right there, the time to do that, then don't shove that process into that kid, because what will happen is ripple effect will then happen. And so we, working with kids to make sure that they're assenting and want to be a part of it. I mean, Russell's like super jazzed about it, but the moment is what's hard sometimes.
Two different, those are worlds apart.
Absolutely. And so everyone has seen this, no doubt about it, and it'll be something that we'll continue to see. And we just work through it with reassurance, like this is safe, this is okay, we know what we're doing, and we get to that. So.
I want to bounce back between the two of you a little bit. We got a lot of questions coming in from audience members, but Dr. Greiner, so you mentioned the vaccine clinic in Wyandotte County, and it just dawned on me. You're right. I always ask that question. Do we think the rollout's going to go as smooth as with adults? And here's a good example of why it's not as easy to help kind of shepherd the kids through that, and that would slow down the process of getting more shots in arms, right?
Right. We don't want to have mistakes. We don't want the wrong dose given to a kid. We don't want in a site where there's a bunch of kids around. We don't want one kid totally losing it and creating fear in the other kids.
Sure.
We at our site we've got some partitions up, but that's about it. People can hear other people. And it's gone surprisingly well, and we have seen a lot of kids feeling relieved once it's over. Having a little bit of this kind of cloud of fear that we've an anxiety that's been hanging over all of us for months and months. It's what the nurses I think are it's really nice to see that when a kid gets done with their shot and they feel a little bit relieved. And I think I think a lot of these kids they're smart enough to know that. That this pandemic has really affected our whole world, and they want to move on just like all the rest of us want to move on.
Well, and on what planet have we ever over-talked the idea of a shot before? It's so, they've been hearing about this for darn near 2 years, and then here it is, and, mom and dad's so proud of you to do something, and
Definitely.
They don't want to let people down, they don't want to let their teachers down, they're like Russell, they're trying to get life back to normal, and they're one shot at a time, so I feel for them, kind of holding on to, that's a big load to carry for kiddos, because again, a shot's a shot for a kid. Dr. Greiner, how are vaccination rates going in Wyandotte County overall before this 5 to 11 group got authorized?
So we're lagging. We've really worked hard. We had 3 mass vaccination sites up for a while. We've done a bunch of pop-up vaccinations. We had incentives for adults for vaccinations, a sort of drawing, a lottery thing, and other various incentives that we were using to try to draw the community in. But we're just a little bit above 52% on our first doses for the overall population. Now we're doing much better in the 65 pluses. I think we're at 79 or 80% on the 65 pluses, but we lag the nation. So and Kansas does too. I was looking at the 12 to 17 year olds last week, and we're about 7 points behind on the 12 to 17 year olds compared to the national average. And I hope we don't lag, but we'll probably lag with these 5 to 11 year olds too. Because it is going to take some special considerations. I think people have probably heard that some of the hospitals and systems in the region are already booked up for the next month or longer with their shot appointments. So we probably do need to do some other outreach. We're going to try to do some school things and other things like that, but it's going to take months.
Yeah,
that's going to be tough. And in schools, again, I can't imagine mom and dad not being there and what that's going to look like if they,
now we'll probably have the parents there.
Parents will have to be there. Okay,
we've sort of said with these kids we got to have the parents there,
especially when you're talking about 5-year-olds, 5, 6.
Yeah, no doubt. Because like even Russell, who's talked about the person he loves most is his mom, and I think that's going to fall for the same way for the vast majority of our kids. It's going to be one of their parents who they kind of will look to immediately for that rock when they're in that moment where there's going to be some stress and anxiousness. God bless all the people who are willing to help, but when they're looking for someone's eyes to kind of comfort them, it's going to be their parent probably more times than not that's going to have to be the one that's going to be there. And so how you roll that out is definitely difficult, and that's why a lot of times when we have these kids who come into the clinic and we could be vaccinating them at that point. They're going to have a parent with them almost any time then, or a grandparent. Those are those great opportunities to not have to do it maybe in a mass vaccine clinic or something like that. Be like, we can do this now. And I think sometimes, a lot of these families have maybe felt like possibly some of their pediatricians have leaned on them some, because they get a lot of this, well, we're still thinking about it. And we know more times than not when you hear that, that's maybe not the most genuine comment, because it's kind of, they don't want to tell you, I just don't flat out want to do it. But you're like, well, when would you come back? We can get you scheduled and some of those things. And so it brings a little bit of stress even into that room as you talk about the vaccine, but it's important to make sure we do bring it up, because if we're not bringing it up, then we're not doing our job of saying, hey, this is kind of what the recommendations are. We could go ahead and do it. I mean, I know Dr. Greiner's in the same place. Many my chart messages, many messages from various places, or people that you just know who are texting you about it, or kind of come up to you on the street or whatever and say, hey, doc, what do you think? And yeah, I mean, it's safe. We've seen it in thousands of kids already in the trials. You go forward with it. I don't think we need to be having the same concern. And what I've told folks is if you're not vaccinating your child, then tell me how you're going to feel when your kid gets COVID and is not vaccinated.
Are we having any concerns about like long-term, long-haul symptoms in kids? Are you seeing anything with those kids that have had
We do
COVID?
see some adolescents who are having some of the long-hauler symptoms. And so we've been seeing some of those kids in the pediatric clinic. And, that's tough. I mean, these are kids who a lot of them have been tremendously active, high-level athletes and some of those things. And just, but more or less like, I just feel like I can't get off the couch. I can't get out of first gear anymore. And those were kids that were always going 100 miles an hour.
That's frightening. Dr. Greiner, jump in on that. Just kind of what are your concerns right now? We're heading into the winter months. People are heading back inside. We're struggling to get kids, vaccinated just for natural reasons, as we see. So just what are your thoughts? What should we do? What advice do you have?
Yeah, I mean, I know we've talked about this. Everybody's tired of COVID. Everybody's worn out and exhausted and wants to have.
Oh,
it happened.
What?
Magic.
Sorry. Whoa, check it. The happy dance on a Monday. He did it.
He just made that.
That's what he needed.
That's awesome.
Oh, I love this.
I don't think too many kids get a vaccine in front of a lot of cameras and lights.
That's right.
Absolutely.
I think the first time I came in, I'd say my heart rate was fast, so I can't imagine at his age.
Right? And bless his heart for wanting to try to do it. But he did it, and that's all that matters.
That's
Way to go. Okay, so we're going to bring Russell back in here in a little bit just to see how he's doing and let us hear what he has to say. But I'm just loving this happy dance. I wish I felt like this on a Monday.
Look at my dancing skills.
I love it.
I think that's what Chiefs
it.
fans were doing yesterday.
This is the Chiefs happy dance. Oh, a little spin. I love it. Okay, Russell, way to go, pal. We're going to get back with you here in just a moment. So Dr. Greiner, we may, while you're talking, take shots of Russell, because, how can we not? So just, again, just those concerns that we're having.
Yeah, I mean, we saw a decline in cases happening, from about the third week of August until just recently, the last 7 to 10 days. And now we've gone into this kind of plateau, and that's worrisome. We have a pretty vulnerable population in Wyandotte County, Kansas City, Kansas. Always have. We have a lot of chronic disease. A lot of those patients come here for their care, but if they haven't been vaccinated, man, we're seeing this internationally too. Wherever there's folks that aren't vaccinated, this virus is finding them, even with vaccination rates significantly higher than what we have here in our metro region. So I think we got to buckle down. We got to keep trying to reinforce, all the pillars of infection control and keep having those conversations about vaccine. As Dr. Lewis said, I'm a big proponent of this is a time when we need to get people into their doctors even more frequently than we would normally propose they do that. Just come talk to me. I am going to try to be open-minded if you'll be open-minded, and
Absolutely.
let's keep having conversations about the data, because we get more data every day as we do more vaccinations, and we've just got to keep having those conversations and try to stay even keel and open-minded.
When you sat down this morning, I said, how are things going? You're like, I just was hoping this thing would be gone, and it's just not. And here we are still talking about it. But other things are happening, Dr.
Yes.
Lewis. And so I do want to just take a moment before we get to your community questions to talk about life away from COVID, which is other issues. We're talking about rhinovirus. So this is the most common viral illness to cause an asthma stir-up. Is this what tell us what you're seeing?
So, one of the wonderful things when, masking was pretty universal, we really didn't see a lot of just general illness, when we went into April and May, right, at the very beginning of the pandemic, sick people in general weren't really happening too much, even before the COVID cases really started to fire up. And so we didn't see a lot of asthma exacerbations, and also just general taking your medications. Remember back at that beginning of the pandemic, you felt like you always saw people outside walking, a lot of people outside exercising, and people were pretty on it with taking their medications religiously. And we've seen, obviously, that stuff kind of change again. And so over, the last couple of weeks, here in the metropolitan area, we have seen a significant amount of kids with asthma exacerbations that were pretty well controlled. And just because you get like a rhinovirus infection does not mean that your kid really needs to have a whole lot extra care needed. But we've seen kids not take necessarily all their medications. And so when this hits them, they've been pretty sick. So we've seen quite a bit of rhinovirus cause these kind of, kids in the hospital, some in the ICU for a couple days, unfortunately.
A little spike in the croup also?
We have, definitely. So para-influenza, that's not influenza, it's another viral infection. But we've seen a lot of kids also in the last week who've been coming into the clinics, the emergency room, urgent care, and also be hospitalized for a couple days because that affects a different part of their airway than like what asthma does. And so there's not a whole lot of medications that really you have at home at your disposal to help. And that seems to always be that kind of barky seal cough at 2 a.m. that always like, oh, my kid went to bed perfect and wakes up. So again, we've seen, like just another viral illness that has kind of come back that has kind of been out of the focus for a while. Like we've seen a lot of things, but now it's kind of everything's kind of coming back a little bit, right?
Do you think that has to do with the masks, schools,
Sure.
people just kind of trying to get back to life?
Yeah, I think it's all. I think it's definitely all of them. Just like in the summer, we saw these tremendous outbreaks of RSV for multiple months that really nobody in pediatric care, whether it's outpatient or inpatient, had really ever seen at that time of the year, ever. And so that was pretty intense and really limited pediatric hospital beds across the country. And now we're seeing just this as just another thing that's coming back. Parainfluenza, the group is going to be obviously a little bit younger kids, but rhinovirus, it doesn't discriminate. It's going to be brand new babies all the way up into older kids and adults too.
So bring your kids in if you have questions.
Absolutely.
Dr. Greiner, again, before we get to questions, just what are your predictions, 2021 winter, just with masks, mandates going away and Wyandotte County numbers and just what you see, kind of the crystal ball moment, what do you envision happening? Another spike?
I think we just have so many unknowns, but I think some of us were kind of optimistic, right? we would run through this Delta variant and get, like, for example, what they're seeing in Japan. But I think Japan is doing a few more things than we're probably likely to do in terms of mask use and getting their immunization rates up really high. We're likely to have this fluctuating plateau through the winter. That's pretty significantly high, and our health systems could get hit hard again this winter, especially if we get other viruses. Our flu shot uptake rates are down this year. It looks like the data from this weekend was showing maybe 6 or 8% behind where we normally are at this time of year for flu. If we get a lot of flu too, our health systems are going to suffer, and the whole population's going to suffer. So I think we've all got to keep buckling down and talking to each other about the smart things to do.
All right.
No doubt.
Okay, let's get to some community questions because you've got some good ones coming in today. And Russell's doing good out there. He's going to come back in and do his happy dance for us. I love that. Okay, Barbara wants to know, do you know when local pediatricians will have vaccines available? They do, don't they? Or not all?
I think, so different practices kind of have, I'd say different, for lack of better words, ownership, really. And how that ownership and kind of oversight of their clinics is going to probably make a difference in terms of what their supply chain looks like in terms of getting vaccines. But most of the places around town do already have it in their clinics. But like we know that a lot of these, as anticipated, there was a huge rush as soon as that announcement came out that it is approved. that as we anticipated, just the phones blowing up at all these places, like where can I go, and so most of the pediatricians' offices though are having it.
Okay, just make the calls. Isaac wants to know, Dr. Greiner, I know that Wyandotte has a large minority population. Is that a contributing factor to the lagging vaccination compared to Johnson County? I've heard of some hesitancy among minorities due to, disparities in healthcare and systems. And how can we help that population? And what insight do you have there?
Yeah, that's a really good question. The hesitancy and the questions and concerns about vaccines, I feel like they've come from all over the map. I'm sure my other colleagues feel the same. The different types of people that have had real major concerns has in some ways been a real eye-opener for me. And so we've got to try to meet people and have those tough conversations as best we can. But in Wyandotte, we do have a very diverse population, about 29% Latino and about 24% African American. But one of the factors that's most related nationally to not getting vaccine is not having health insurance. Not because the vaccines aren't free, they are free. There's all sorts of places you can go and get a free vaccine, but people that aren't insured or people that are lower income, they have more complicated lives, right? A lot of these people have 2-3 jobs. A lot of people, we've had a school clinic in Wyandotte for a number of years that some of the faculty here work in, and it's much easier for those parents because if they have 2 or 3 jobs, they don't have time to take their kid to the pediatrician or the family doctor for that appointment. So we've really got to find ways to meet people and make it as convenient and as easy as possible. Our mass site is going to be 3 days a week, Wednesday through Friday, from 10 a.m. to 6 p.m. at 78th and State. It's open to anybody. You don't need an appointment. We've tried to walk in because it's a little more convenient. So I think that gets to the question: what can we all do that makes it convenient? And having your doctor have it in their office is a convenience too, because if you come in for something else, right, you can get it then. And I know all of us will be pitching it that way every time we're in the office.
I'm glad you bring that up. I mean, because you're right. We all live in our own heads and our own worlds, and we just think it's a matter of, calling, getting some time off from work, and running down to the doctor's office, and it's just not that simple, right, Dr. Lewis?
Yeah, it doesn't kind of seem to work as well than when you put it in your mind, like, let's go pretty quick. Sometimes it just doesn't, but yeah, I mean, is what Dr. Greiner pointed out. I mean, let's say you have an appointment for your kiddo at 2 p.m, and you're working 2 to 3 jobs, and suddenly there's a couple bills there sitting there that you have to get paid at home, and you're trying to figure out, do I take my kid to the doctor today, or do I pay the bill to keep this going? And I think that's what a lot of times, we see is where people have to make these tough decisions. And that's where we see the lack of care sometimes. Not because they don't want it, but they're having to make decisions that are not easy decisions. So.
Wow. I guess I'm just trying to take all that in, because you're right. We come down so hard on people who don't get vaccinated, and we just safely assume it's some political reason, or it's just they don't want to get it, just they're pushing back, and they don't want to be told what to do, but it's not always the case, and quite frankly, it may not be the case in a lot of those. So, thank you for bringing that up, Jennifer. Dr. Hawkinson has a question for you. She wants to know. You reminded us on Friday to get our flu shots. I got mine that afternoon, so thank you. Yeah. How soon after my flu shot should I expect some level of protection against severe illness from the flu?
Yeah, we do say 14 days, that 2 weeks after vaccination. That's fairly general for most vaccines, especially for COVID. For influenza, it's probably about that 14 days. You will start having protection with the immune response from T cells and B cells creating antibodies, probably about that 10-day, but for really full protection, it'd be that 14 days. Anytime after 10 days, you are going to start having some protection, though.
Okay, and then Ross wants to know, do we know when the J&J booster will be available?
No, I haven't heard any data about that. Basically, I think it's actually for most all the vaccines you can. It's just a matter of being able to get the vaccine, being able to get J&J.
Heard anything about that?
Well, 2 months after a first shot with J&J, people who meet the criteria and have risk factors can certainly get it. So we are pushing those second shots 2 months after for folks.
Yep, but I think a lot of what happened was there was a lot of media coverage of the mix and matching dosing, and so a lot of people are getting that mRNA platform dose after the J&J vaccine dose.
And Dr. Hawkinson, Tanya says she got her flu shot on Friday also. You're a big influence.
Yeah, that's good.
Nice. You told people
Good.
to go out and get
My
it.
kids got theirs last week as well. So, luckily we do have very low activity in the United States right now. Let's hope that continues. But we typically don't see large increases in influenza and really till after January. Some years we have earlier, late November, early December types of peaks, but hopefully we will keep it low. But again, as we've heard our guest talk about, with reduced masking and restrictions, I think that will play a large part of this as well.
So Tanya wanted to know, though, she has a big red knot on her arm. Is that normal?
I think with any vaccine it probably can be. We certainly know with the old smallpox vaccines that caused a lot of local damage and inflammation and inflammatory response. It can happen with any of these vaccines, really. I wouldn't be too worried. It should start to get better in the next 2 to 3 days.
Marla has a question, and doctors, I'll ask you both. Should schools continue to require masks even though the mandate in Jackson County has been lifted? Just what are your thoughts?
That's a tough question. I think that, the political will for that is sort of waning. But I think with the level of transmission we have, certainly from our public health position in Kansas City, Kansas, we will continue to make that recommendation because we think it makes sense for now. We're still seeing clusters and outbreaks in schools. If you look at the statewide Kansas data, they've put some really good data together on the schools that have mask mandates versus the schools that don't. And it's just obvious that they're getting more cases in schools that don't have mask mandates. And so until we get more vaccine in arms, I think it makes sense. I think it makes sense to have masks in schools. Now, the school boards are in charge of that. The new state laws make it such that the school boards have to make that decision. So we'll see.
And they're making decisions, though, based on the recommendations, though. And they say they oftentimes feel that pressure because they're following the guidelines when it comes to the rules, but then when it comes to lifting the mandates, they feel pressured, I think, from parents to say, well, you were doing that all along, so why are we not listening now? I'm sure you never get this question, Dr. Lewis.
Maybe once, or I think I've responded to 3 emails this morning before I came here about the exact topic. And I think it kind of comes down to understanding like what's our end result and why would we want our children masked? And I think as before school started and was here, we talked about this topic too. Is ultimately, I think almost every single parent has been wanting their kids in person in school. And we know what vaccination rates are probably going to be. So as we know that, and we're talking about wanting our kids to be maintaining in school, how can we do that? Well, that's infection prevention and control measures outside of vaccinations. And so as opposed to having one kid who maybe pops up to school, feels relatively fine, and then 24 hours later does not feel great, gets tested and is positive, and the whole classroom hasn't necessarily been exposed, you now have a classroom who's probably going to be going into a quarantine. And I think many people would prefer to not go back to the online education that and how that whole thing rolled out, especially this year because there was a very, very few opportunities for online education. Schools have not had the same amount of infrastructure that they put in last year. So as a result, it would probably not be the most smooth process in the majority of classrooms and how that goes. And then we go back to, as what Dr. Greiner says, not everybody has the ability to do their job from home.
Right.
And if you don't have your ability to do the job from home and your kid is now going to have to be at home for 2 weeks. What exactly is that ripple effect again into that home? And so what we keep seeing is this, it just like kind of compounds on itself.
Right.
And so, I think it makes sense that we continue to do this for now.
All right, thank you for that insight. Mr. Russell is back. We're giving you a big round of applause, pal.
Good job, buddy.
We love this.
I got my shot outside.
Okay, how'd it go?
Great.
Well, wasn't too bad. Did it hurt at all?
It did hurt a little bit, but I was listening. But I was talking about so many things. It barely made a difference.
So you just took your mind away from it, right?
Yeah.
You thought, I got to get this shot, and I got to show what a brave guy I am. And here you are. How's it feel to be vaccinated?
Great.
Great, Mom. What's this moment like for you?
Oh, this is awesome. We're so excited to be able to have him ready for Christmas so that we can go see his grandparents and not feel scared.
Fantastic. What are you going to do? What's the big prize now that you got his? Are you guys going to do something fun?
Oh, what's the thing you haven't been able to do for 2 years that you're going to get to do after your second shot?
Going to Sky Zone.
Oh my God. Zone after shot number 2. That is super fun. You'll be ready. You'll be safe. You're going to have a ball. Thank you so much, Russell, for coming in and doing this with us. And you're going to be back in a few weeks. Do you think you can do good on 2?
Yes.
Yes. All right, let's do it.
Good job, buddy. Congratulations.
Oh, I love it.
Good job.
Oh.
Yeah.
Yeah.
Yeah, you're good to go. I love it.
I just feel so honored because I just love all of the people looking at me and appreciating
They
me.
are looking at you.
And
You like those proud doctors looking at you, don't you?
Yeah.
And we're so grateful to feel safe, right, Russell?
Yeah.
All right. Okay, so we're going to see you in a few weeks, right? Okay,
Yeah.
come back and see us, promise?
Yeah.
Okay, guys. Have an awesome week.
Yeah. Thank you.
See you later.
Russell.
There you
Going
are.
out.
That's you on TV.
I'm
That
going
is you.
out. I'm going out.
See you.
Bye. Bye.
You could do a little dance. Can you do a little dance for us?
There you go.
You got the moves, dude.
Moves like Jagger. Ratings bonanza. Here we go.
All right. Mom's like, wait. She's like, did you just get him started on dancing?
It was a shot of sugar. It
I was
wasn't
A
gonna
shot of
say.
sugar. Got it. Perfect. Hey, Russell.
I know,
Russell,
that's great.
Can you give me a high
Hey,
five
and
or a
I
low
think-
five? Awesome. Okay, so you come back and see me in a couple weeks? All right, I'll see you later.
And that's another
Yes, we will.
another great point Dr. Carnes made.
Yes, we will.
Children are able to go back to school after getting the vaccine, which is a very good thing.
Remember, I asked you because I said
Yeah.
my kids were going to get theirs. I was a little nervous about sending them back to school, wondering if they were going to feel good or not, or have any fevers, and they were fine.
Anyway,
Dr. Lewis, your
anyways,
kid was
now we can
good
take
to
the
go.
microphone.
Yeah, he actually got his flu vaccine and his first COVID vaccine, my son, on the same day. And I think he had 4 soccer games and a basketball game or
Wow.
something like that weekend.
He wasn't missing that.
No, absolutely not. My daughter, who's been vaccinated in the summer, she did great too.
Awesome. Good to hear it. We just like to hear more of those stories from parents.
Yeah,
to say,
absolutely.
again, no bad reactions, nothing like that. Couple more questions, and then we're going to wrap up. Just a question about, will this winter be as bad as last? After all, back then, there were no vaccinations. Is it fair to say no vaccinations, worse winter? Now we have vaccination, a better winter? Not necessarily. I don't
Yeah,
like that shaking of your head.
I think we just don't know. Again, I
Yeah.
think what we're seeing with this Delta variant is it really does seek out those vulnerable groups of people, those people who haven't been vaccinated, and it finds them. And there's enough of them out there that we're going to see numbers. I think we're all hopeful it's not as bad as last winter, but it's a different variant this time. Yes, the vaccine is going to help us. Without the vaccine, with this Delta variant and this winter, we would be in major trouble.
Thank you for the reminder, because we've been saying Delta is different. We haven't said that in a while, and I think that's when we start looping around to another, winter season. You have to go, what was different? Well, Delta's different, so that makes sense. On that note, a couple more questions. Deb says, Thanksgiving, 5 of us all totally vaccinated except for one who's only had 1 shot. Should we all still be masked? Should it still look like last year's Thanksgiving? Everyone vaccinated, only one person has 1 shot. Is this a yes, Dr. Greiner?
It's a great question. I think that person who's not fully vaccinated should mask.
Okay.
Yeah. You've got, you have 2 weeks. I don't know if the person's getting it in the interim or not, but they probably won't be 2 weeks out from their second shot.
Sure.
So that person's the one that's.
Doc Hawk?
Yeah, we are really getting into kind of granular splitting hairs here. It does also go down to what is your risk tolerance, the risk tolerance of you individually, but you with your bubble or your family. And so I think if you can take all of those things into account, really understand what are you doing that 2 weeks leading up. Do you think you are going to be exposed, or maybe that person that's not fully vaccinated is going to be exposed. And it really just goes to your comfort. It sounds like you have been doing the right things, and almost everybody is fully vaccinated. Overall, you should be safe, but you have to understand who are the other people that you may have contact with. Are they going to be at risk of severe disease? Vaccination does look to help diminish transmission. Maybe not as much with Delta as some of the other previous variants or the original Wuhan strain, but you still will have some reduced transmission as well. Certainly you're going to have reduced disease, and so that's important. It's really just a matter of taking into account all of those things and what is your risk tolerance.
Last question, and anyone can jump in on this one. Amy is curious if you have heard anything about allergic reactions for people with allergies to penicillins. Everything I've heard says it's okay to get the vaccine, but I feel you guys may have a little more medical data to back that up. Any word?
It's not been something that we've seen as a complication of that, and we have a lot of kids so far who we've seen through our clinic come through, and I don't know the percentage of the kids we vaccinated who have a penicillin allergy, but I am very confident that there's been multiples, and we've had actually no complications really out of any of the kids that we have vaccinated out of our clinics, or even in the hospital too. So I think that that's probably one of those things that may have been a one-off situation that was more like, oh, this kid maybe had a penicillin allergy. I wouldn't expect it to be a big problem.
Yeah. And my concern more is with the penicillin allergy. Certainly with adults, what I see, I have to deal with this every day, and a lot of people say they are allergic to penicillin or something of that nature, penicillins and other antibiotics. When you really deep dive into it, it's more of a reaction like nausea or vomiting. Over 90% of people who say they are allergic to penicillin are actually not allergic to penicillin. That's pretty well documented through the literature as well. So,
All right, we are going to get to final thoughts here in just a second, but don't forget to send in photos of your kids getting their vaccines. We are learning that it really helps for kids to see other kids going through that first, doing things like what Russell just did, and being brave. So we appreciate that, and they're really being great stewards of health, public health safety, and we appreciate that. And we just want to show them off and show their faces and let them be leaders in our community. So get those sent in this week for us. We'll get them shown here on the show. But final thoughts, Dr. Greiner, I want to start with you. Just kind of what do you want us to know? And then is there any more information you can give people about the vaccine clinics coming up, or where they might find more information about that?
Sure. For Wyandotte County, as I mentioned earlier, we've got the mass vaccination sites still going at the old Kmart at 78th and State out in central part of the county. It's open Wednesday through Friday, 10 a.m. to 6 p.m. Still doing adults, doing boosters for adults that are eligible, and now doing the kids, walk-in basis, and we have capacity to do hundreds a day. So we're ready to go with that. And again, I think my final thoughts are, please go get your vaccination. If you've still got concerns and are worried, please talk to your doctor. Please do it in person. Go see your provider. It never hurts to see your provider and have those discussions. So I want people to keep an open mind, and we can keep making progress on this as more data comes in.
Thanks for pushing that point home. I appreciate it. Dr. Lewis, thanks for being with us this morning. For your final thoughts.
No, I would just say I believe in getting the kids getting vaccinated, because I think it's one of those ways that, you don't have to feel anxious about your kid in a group activity, about them at school. And also, don't forget about the flu vaccine, as Dr. Greiner had mentioned. We were seeing some decreased percentages of flu vaccination rate, and we didn't really see flu last year. I mean, it was kind of a big nothing burger and we're not sure what to anticipate this year. But as we've seen many other seasonal viruses kind of starting to pop up, I think that increases some concern that we will see some flu rates go up eventually. And they're safe to get those vaccines at the exact same time. I mentioned my son, who's 11. He got his vaccine, like, not this last Friday, but the Friday before, both the same day, and has done fine. So please remember that COVID vaccine, but also your flu vaccine too.
Great reminder to parents. And Judy said, love Dr. Greiner. He has done so much with medical students working free clinics in KCK. His heart is huge.
Thank you. Our students have been awesome. We still got them contact tracing, and we're trying to find some to help with this pediatric stuff who are interested in peds. So the students are amazing.
Oh, God. Well, they think you're pretty amazing, too, out there. So thank you both for
Yeah.
being here. Dr. Hawkinson, final thoughts?
Yeah, I'll support my pediatrics colleague. And please, if your children are behind in their vaccines, please go get them vaccinated. It's a way to protect them and other people around them. And Dr. Greiner and I were talking just before the show, and I think, unfortunately, it is going to be down to protecting your individual bubble and your individual people that you know as we move forward with lack of restrictions, masking, distancing, those types of things. And the best way that you can protect your bubble, your people, is to get vaccinated individually. And then just understand those certain circumstances and those high-risk situations that you may be going into. And if you do that thoughtfully, you will be able to keep everybody around you safe.
Doc Hawk, thanks so much. Yeah. Okay, thank you all for being with us on this Monday. Coming up tomorrow, many are wondering what the next few months will look like across the region as the holidays kick in and people are huddled up inside. Dr. Catherine Satterwhite with Health and Human Services, along with Don O'Connell, the Assistant Secretary for Preparedness and Response. They will both join us with an update on COVID here in our region and what current case numbers mean now and as we head toward another year. And Dr. Stites is going to join us tomorrow as well. So we will see you tomorrow. Have a great day.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.